Hi everyone, I hope you're all well. It's great to hear that many of us are coming from all different time zones, so I hope wherever you are that you are well rested and as excited as I am to dive into PCOS research. My name is Jessica Sidrak. I am a third-year medical student at Rutgers New Jersey Medical School in Newark, New Jersey, and I'll be discussing PCOS dietary content on TikTok. PCOS is a fairly common endocrine condition affecting an estimated 1 in 10 women of reproductive age worldwide, with some estimates saying that that number may be as high as 1 in 5. Now, part of the reason for that gap is because PCOS is grossly underdiagnosed. Many of the symptoms such as chronic fatigue, cystic acne, facial hair growth, hair thinning, or weight gain may be overlooked as signs of stress, which is particularly interesting since we know that PCOS is associated with stress and elevated cortisol levels, which can exacerbate those underlying symptoms. Some women also may not be aware of what constitutes an irregular period, whether their period comes too frequently or too infrequently, and so as a result they may not seek medical attention to begin with because they're not aware that there's a problem. Unfortunately, that means many women may not be diagnosed with PCOS until they begin experiencing problems with fertility later on in life. This is unfortunate because even though PCOS is not a curable condition, it is a manageable one with appropriate dietary control and weight loss if it's indicated. Now, with the shortage of healthcare workers in the US, many women diagnosed with PCOS will inevitably look to social media, especially to TikTok, to answer their questions about PCOS dietary guidelines and health and wellness with PCOS. Knowing that, we asked ourselves, what does the landscape of PCOS dietary content on TikTok look like? More specifically, we wanted to know if it's evidence-based, and if it's not, who's putting out that content, and could there be a conflict of interest with ads or sponsorships? To do this, we used the Johns Hopkins Medicine PCOS dietary guidelines, which come from a credible medical institution, actually one of the foremost medical institutions in the United States, as a reference for current standard of care in PCOS dietary management. So moving now to our methods. Using a web scraping tool, we searched for the hashtag PCOS diet on TikTok and extracted the top 100 videos. We then removed any duplicate videos or non-English speaking videos, and the remaining 95 videos were then divided into those by medical creators or those by non-medical creators. We define medical creators as being physicians, nurses, PAs, dietitians. Nutritionists and laypeople were categorized as non-medical creators. We also divided those videos into categories as informational, personal, or misleading. And then we took note of the number of videos that tended to contain ads or sponsorships. All videos then received the GQS score, which is a standardized metric for assessing the quality of a video. Informational videos were also given a Discern or MDiscern score, which are standardized metric tools for assessing the understandability and actionability of a video. We recorded those key metrics in the table on the right. It's a lot of numbers, but the most important thing to note is that there was no statistically significant difference in the average views, interactions, or days since posted between the medical and the non-medical creators in our sample of videos. Of note, there was also no statistically significant difference in either the GQS scores or the Discern MDiscern scores between both groups, meaning that the videos from both groups of creators were of equal quality and they were equally understandable and equally actionable. So that's what's reflected in the box and whisker plot on the left over here. It's also worth noting that the scores reflected here are averages from 2 independent scorers. We also wanted to see what kinds of videos were being posted by medical versus non-medical creators. Overwhelmingly, both groups tended to focus on meal prep/plan or dietary recommendation videos, which are shown as orange and purple in the bar chart on the right. Non-medical creators tended to mention supplements or medications more often than their medical counterparts as well, and that difference was statistically significant. So if you see in the bar chart on the right, there is a sizable percentage of videos that were mentioning supplements or medications in videos by non-medical creators. So we dive into that a little bit more over here. There was a statistically significant difference in the percent compliance with the JHM PCOS dietary guidelines between the two groups, with 96.2% of medical creators being compliant compared to only 71% of those by non-medical creators. Of note, the JHM guidelines are fairly broad and they provide relatively common sense dietary advice. They emphasize whole unprocessed foods like lean proteins, healthy carbs, healthy fats, while limiting sugary drinks, processed snacks, fried foods, or refined carbs, things like white bread or pasta. All of that is to say that it is fairly difficult to be non-compliant with these guidelines. The videos that were non-compliant often inaccurately advertise certain supplements or combinations of supplements as at best staples for PCOS diet and at worst as outright cures for PCOS, which we know not to be true. Those videos tended to include ads or sponsorships for the supplements that were being discussed in the video. And as you can see in the chart on the right, of the 14 videos that contained an ad or sponsorship, 13 of them came from non-medical creators. So as a summary of what we've discussed so far, we know that videos from medical and non-medical creators had similar average daily views and interactions, and that there was no statistically significant difference in their quality, their understandability, or their actionability. Interestingly, we found that 70.5% of the videos that we analyzed were by creators diagnosed with PCOS. So what that tells us is that an overwhelming amount of the PCOS dietary content online is coming from PCOS patients, which can be a good thing because that means there's first-hand experience with what they're talking about, meaning they've tried and tested it. However, that can be problematic because, as we know, anecdotal evidence tends to be lower quality with an increased risk of bias. So what that tells us is that there seems to be a shortage of licensed medical professionals on TikTok who are able to provide that objective, evidence-based information that's coming from the literature. We also saw that 3 users accounted for almost 40% of PCOS dietary TikToks that we analyzed, with 2 of them being non-medical creators. And that further adds to that risk of personal bias, especially with the lack of diversity in the videos. As a refresher, we did find that 96.2% of the TikToks by medical creators were compliant with the JHM PCOS dietary guidelines compared to only 71% of those by non-medical creators. 71% is a good number. That's actually almost 3/4 of the videos by non-medical creators, which actually surprised us, but that number can be better, especially with an increased online presence from licensed healthcare professionals. The good news is that the most popular diets that were mentioned, which were high protein diets, low glycemic index diets, and anti-inflammatory diets, are all JHM compliant and equally mentioned by both groups. And again, as a reminder, we saw that the majority of TikToks from both medical and non-medical creators were meal prep or meal plan videos, as well as dietary recommendation videos, with discussion of supplements being much more common among non-medical creators. As a reminder again, if you look at the pie chart, of the 14 videos containing ads or sponsorships, 13 of them, 93%, came from non-medical creators. Bearing this in mind, we conclude that even though PCOS diet TikToks by both medical and non-medical creators were equally understandable, equally actionable, and of similar quality, the PCOS dietary TikToks by non-medical creators overwhelmingly tended to be less likely to be compliant with the standard of care as defined by the JHM PCOS dietary guidelines compared to their medical counterparts. It's also worth noting that the lack of diversity of accounts that are generating that PCOS dietary content on TikTok, as well as the prevalence of ads and sponsorships that can sort of fuel the fire for misinformation, especially in videos by non-medical creators, warrants further investigation, as well as should encourage an increased online presence of licensed healthcare professionals. We also wanted to mention 4 main limitations with our study. The first being that we only examined 95 videos, and as we all know, there are many more than 95 videos about PCOS diet. And so our sample may not be representative of the entire population of PCOS dietary TikToks. Also, the two scores assigned to give the GQS and the Discern MDiscern scores were medical students, which may skew towards higher understandability scores just because of their educational background. We also used the JHM PCOS dietary guidelines as a reference for the standard of care in PCOS dietary management, but as we know, medical education may take a decade or more to catch up with new research, and that the guidelines, even though they are the standard of care, may not necessarily reflect the most up-to-date data that we have available. We also chose to classify nutritionists as non-medical creators due to the differences in their training and their education, but had we chosen to include them in the medical group, that may have created a more noticeable difference in the gap in JHM compliance rates, or even in the quality and understandability scores between the two groups. So again, these are all things that are worth bearing in mind. That being said, we encourage other teams to repeat this study, especially if they're able to address the limitations. The importance of this is that understanding the gaps in PCOS dietary advice on TikTok can help public health professionals and clinicians generate balanced, targeted content that addresses patient needs. On behalf of my entire team and myself, I want to thank you all for your attention. It was an honor to be able to participate in PCOS Congress 2025. If you have any questions or would be interested in collaborating on future projects together, please do not hesitate to reach out. I've left my email here. Again, thank you for your attentiveness, and I look forward to hearing from you all very soon.